Well, good afternoon, everybody. This is the Healthcare Quality and Risk Matters after show, the very first one by popular demand. So I hope you will enjoy the content today. We're going to attempt to expound on our August topic of HRO and get into a little bit more detail, say things we wouldn't necessarily say in a live broadcast, but would make it available to you guys through YouTube on our YouTube channel. Gentlemen, glad to see you here on a Friday morning, Friday afternoon, however you want to put it. Rob Santamore, our resident registered nurse and everything quality and risk expert. And we've got Dr. Timothy Brown, our resident professional when it comes to hospital administration and everything about the back office. And my name is Gary Bierce. I'm your resident risk management expert. Guys, HRO, the live show, we covered a lot of good stuff. What didn't we cover that we need to cover here in the after show?
So we touched on it in the initial show. But I would really like to dig a little deeper into how far behind healthcare is. These HRO concepts have been around for 40 years, if not more than that.
And wait a minute, Rob. I've been out there talking to people, and they all are claiming, oh yeah, we got this. Oh yeah, we got this. Are you saying that that's not true?
So it's not true. Obviously not for everybody. There's some are able to meet that. But for the most part, it actually can't be true. Because of the core principles of HRO, right? High reliability organizations. There's remove people-driven processes to ensure clear and consistent outcomes with implemented processes that are validated and clear, right? And when you have disparate systems, right, and talking about, there's not just incident management and CAPA management, right, but those are very often disparate. But then you have to go somewhere else for document control. You have to go somewhere else for your proactive assessments, such as like auditing. And then you're purchasing other software that is to abstract data that then aggregates it so you can interpret what you've put into these other three systems. So you have all of these people-driven processes and disparate systems that create true gaps. And gaps in and of themselves, negate your ability to become a true HRO.
Absolutely.
So a system like a ParitySoft Healthcare, which is unique in the marketplace because all of these things are in one place, is the only way, if you're going to just boldly say it, if you want to be an HRO, you have to have a system like a ParitySoft Healthcare. Is that a fair statement?
You do have to have a system like a ParitySoft Healthcare because it removes the people, right? We want to set our people up with the tools they need to be consistently successful, right? That's part of being an HRO. You are consistently successful at your work. You have to go to an email to find responses. There's two things that you've abstracted from other systems. Whether it be an incident or an audit finding, then you're relying on people to be available, right? Healthcare people are not available. And you're relying on that person to remember to do it in the chaos that is healthcare leadership and management. Or programs like software, like solutions, like there's ParitySoft Healthcare. Remove that person. And create a tool that forces you to see what the next step is and highlights what has been missed. So it takes gross negligence to let things fall through the cracks rather than taking a massive amount of effort to keep the cracks closed.
Right.
Absolutely.
In the news, Timothy, we learned about a hospital that recently was shut down. And we've been saying this for a while. If you're out there as a hospital and if you are so arrogant to believe that if you ignore quality, it's not going to happen to you, well, it happened and it was big news. about this. Could it have been avoided, Timothy? And
Absolutely.
even after things were in the down spiral, what could they have done to save the hospital?
Well, I think the biggest thing is be honest with yourself. At the end of the day, if you're an executive
Yep.
leader in your organization, you should have a pulse on what's going on in your organization. You should understand what the current issues are. And if you don't have a system that keeps up with this information, shame on you, honestly, in the age of 2024, in this era where we have all of these abilities to be able to have AI or any type of system that will track it. A ParitySoft really is that one that's going to help you understand it. And I honestly, had this healthcare organization had a system of a ParitySoft, understood how to identify these issues, would have been identified early on. And as Rob said, you would have had an intentional track of being able to understand what's going on, how to fix it, and how to potentially prevent it in the future. So absolutely, it could have been avoided. And unfortunately for that community, they now no longer have a healthcare system that they can go to.
What's interesting, Timothy, when we talk about this, I mean, I don't know if our audience fully understands the depth and width that we can go with a ParitySoft Healthcare. But for instance, in that example, the hospital ended up having the doors shut. They could have run in the same system a vendor risk management assessment for all vendors in the hospital and maintained it in the same system with similar analytics that they could apply CAPAs to, which would be recommendations for the vendor to close, just as they do with other things. And it's remarkable to me that people don't understand that if you're working with just an incident handling system, and then you're over here working with SharePoint with your document control, and in most cases, Rob, they're probably working with Excel to do their analysis, right?
Yep.
They're working with Excel, or then they go over, they have some project management tool that's clunky to try to do their CAPAs, and it doesn't talk to anything else.
No.
Nowhere along the way here are they maintaining a centralized scoring system where they can know where they are at the pulse that can be reported to the senior leadership daily if they want to. That's a truly integrated system. And as far as I know, and gentlemen, I know you're more in tap of the market, there are no other software tools that are able to do this for you. Is that true?
Especially the scoring piece, right? So you'll have other softwares, and I've used other softwares that claim that they have these integrated abilities. My experience in using them is that it moves data from one space to the next, but requires your intervention. There's either support that move, or requires your intervention. There's to validate the data being moved, right?
Which is prone to error right there to have to do that.
Absolutely.
And that process doesn't make sense when you have tools like a ParitySoft Healthcare, who there's designed intelligent processes to where I, as a risk manager, quality manager for the hospital, can walk in, sit at my computer, and say, wow, there's this many incidents there's risk level that I need to start with today. And now I've managed my own work. I can manage the risk of the entire facility. And as the hospital executive team, I can coach them into doing the same thing, but from a greater scope, in sitting down and opening up dashboarding and saying, wow, labor and delivery, you all have some pretty significant risks and very low quality. And I can see that today. I can have you use your words, Gary. I can have my thumb on that pulse or to be medically accurate, your finger on that pulse there, and use your thumb.
I'm not a nurse.
I was just like, well, I see RN next to my name. I should probably show that I do know what I'm doing. And they can sit down and say, I can manage my daily resources, my daily operations, and my overarching annual strategic planning. There's from a centralized system. So that hospital that we were talking about in Ohio that had their doors closed, had they qualified their vendors, gathered appropriate documentation, done appropriate screenings and assessments, their liability, and I can only speculate, right? There's what they publish in media, there's all of the details, but from what was published, it's really clear that the hospital was held liable for bad contracting with the laboratory. And in my experience, that means the hospital did not have documentation to say they did a good job validating that
no vendor risk management at all. Zero.
That laboratory was safe to work with, had appropriate licensing, had clean audits. There's regulatory standards needed in order to work with them. And had they had all of that documentation, it's pretty clear to speculate that liability on the hospital would have been reduced or removed. That was a $25 million bill that essentially canceled out the ability for that hospital to continue to function, all because they did not have systems in place to ensure they were removing risk where possible and ensuring high quality.
Here's the thing too, though, Rob, that I think Gary kind of hit at earlier. It's this death cycle of disparate systems that we don't really talk about. We're so used to being non-functional in healthcare that it's almost scary. And we know how to create walk-arounds or wraparounds for these systems that just really don't work and don't perform the functions that we need. So we go down this death spiral of losing documents and not being able to keep up with overall incidences, and in some cases don't even report things that we should be reporting in a healthcare system because the process is just too convoluted, it's too complicated. And it should not be that way for people that are caring for people at the end of the day. So for a healthcare system, as you said, to not have a vendor cycle, I'm just wondering what other processes within this healthcare organization have gone wrong in addition to this inability to keep up with their overall vendors and keeping up a cycle to ensure that you have the right vendors and they have the right qualifications. What other things were going wrong? Because, $25 million is not a small piece of change for anyone.
For a community hospital.
Especially for a community hospital. Yeah. And think about the job loss within that overall community. No longer a healthcare system. That could really shut down and cripple an overall community without a healthcare system.
Well, I love you said cripple a community because now every single one of the patients that were using that hospital for emergent acute care have to travel farther. There's for that acute care or cripple the capacities of the other hospitals within that designated service area. And people are going to increase morbidity, increase mortality. Their travel time to care, does reduce, there's your outcome. It just does.
Correct.
As a over 20-year business owner, former CFO, senior executive in a multinational corporation, looking at the healthcare industry through the way you guys describe things, I'm appalled. I really am appalled. There is so much waste in how they manage the business because of being very stubborn about what they invest in. It's almost as though healthcare leadership doesn't understand the fundamentals of a return on investment.
They don't.
They understand the importance. And there's no doubt about that. I mean,
I think he just went on mute. There we are.
Yep, something dropped there suddenly, and I don't know what happened. But where was I before I was rudely interrupted by the gremlins in the technology world?
There's talking about how there's leadership does not understand not root cause analysis. Well, they don't do that either. There's return on investment.
Return on investment. So they do understand. Like, for instance, you guys know I've had 2 hips replaced. The hospital that I went to took it seriously to invest in the most latest technology on how you do orthopedic surgeries and joint replacements, and got all the right equipment. So they spent the millions of dollars to have it, but then I benefited. I was able to have what they call an anterior method. I was fully recovered really in about 6 to 8 weeks from a total hip replacement.
That's awesome.
Remarkable. And they're good about that. And that's a good business decision as well. But then when you come to them and say, look, you need to have a better quality system. We're wasting money here, 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 and here. It's almost like they have blinders on. They just don't understand. Because in their mind, it has nothing to do with new services, new things that we're offering to our patients, which it really does in a backhanded way, not backhand, but a side door way. It does, because by investing in the right systems, I'm now freeing up cash that can be put into those types of things.
Yes.
Second, I'm putting assurance on the processes and methodologies that I bring to the table to take care of my patients is being followed in a consistent way. Which leads me to something that you once said, Rob, going back to HRO. You once said that somebody could not become an HRO if they don't really use a PeriSoft Healthcare. We are, in a way, the vehicle to get there. What is specific in your mind? What is specific about us that makes it a highway towards HRO for any organization? What does that?
So starting with the software, there's the software itself. Is designed by healthcare people, right? Those on this call. There's myself, Timothy. And Gary, I know you claim to not be. There's a healthcare background, but your risk background and what you've learned about healthcare over the years of us working together. Sorry, you're a healthcare risk and quality person now. I
gotta put that ribbon on my chest.
Right there, and then bringing in Jason and all of those thoughts, all of those clinical people that have a quality and operational. There's background in hospitals. There's developed a flow that makes sense for hospitals rather than the oil industry or for Toyota, right? And we do things different than manufacturing. We're not building cars. We're not pumping oil. We're saving lives.
Yeah, right.
That's what healthcare does.
That's right.
So stop trying to adapt things. It is that process, is that developed process where we removed the gaps and people-driven processes within that. There's track of work, right? Whether it be risk or quality or auditing or document control or data and analytics. There's those gaps have been removed for easy to follow processes with reminders, right? With triggers, removing the need for somebody to remember to do things. I'm going to get frequent emails that are going to annoy me to the fact that until I get my work done, that's going to help my patients, right? There's all of those in place, but you also get a solution. There's a solution support from our team, where we also bring our expertise in the fact that there's had personal experiences working with hospitals that have failed and been very lucky to work with hospitals that have succeeded. So we can help support that from the outside perspective. There's giving that third party perspective that sometimes we have blinders on. And sometimes we need to nudge our leadership to understand the importance of change. I have a horrible story about change management. We were at a hospital going through a pretty significant audit. That cost millions of dollars in the end. And I said to the CEO, you need to implement a PeriSoft Healthcare. It's probably the fourth time I've said it directly. And he's getting frustrated. He's getting annoyed because he doesn't want to invest in the removal of people-driven processes and the implementation of a HRO system, to the point where he snapped and said, I need you to change all of this immediately without making any change. And what he meant
explain that.
He didn't want to be uncomfortable. He didn't want to invest. There's something that is going to improve their organization long term. And I think I don't know if it's an ego thing. I don't know if it's a knowledge gap. I'm really not sure exactly where to pinpoint it, but we need leadership in hospitals that are thinking about their billing and revenue from a linear perspective to stop it. That is not how people work. That is not how hospitals are run. And as evidenced by that Becker Hospital review article, there's a whole hospital shut down because of there's relationships, because of bad contracting, bad quality, and bad risk.
That's very interesting. What the response is from the boss like that, and to me, they're missing a fundamental aspect of a ParitySoft, and that is it's easy. It's very easy to use.
Yeah.
It's not. I think everyone has a feeling about systems is that, oh my gosh, the integration is going to take a year. I'm going to be disrupting everybody in their jobs, blah, blah, blah. Where we went the lengths to make sure that would never happen, that it would be a simple transition. And for those who are willing to listen to our after show today, we'd love to show you just how easy it is, and and have those assurances about that.
Well, and it's customizable. You don't have to learn the language of the automotive industry to implement the software.
Right.
Well, one, its base template is written in healthcare language, and two, because in healthcare quality we like to make up a whole bunch of words that mean the same thing. We will change the words for you so it makes sense for you.
Now here, this is the last thing, and I'll bring this to you, Timothy, and maybe Rob, you could put up a graphic for Timothy. But you hear people talk about HRO, that now the regulators are demanding it, so forth. But we take a different view. And our view is, wait a minute, this is all healthcare quality and risk, and it's a journey, and that journey is along a pyramid. And you can't just snap your fingers and a few months later you're an HRO. It doesn't work that way.
Right.
There is a journey you have to go through, and start the journey. Figure out where you are and start that journey to becoming one. And your patients and your business will thank us for that advice.
Yeah,
absolutely.
So
employees as well.
So Timothy, my question to you is, let's talk about this journey. Okay. You've got a hospital, you're out there talking to some folks, and they're somewhere between a tier 3 and a tier 4. And they're right now figuring out, how do I just get out of this hole I'm in? How can I even think about HRO? What do you tell an organization like that?
The first thing I would definitely talk to the leaders about this situation that they're currently in is, number one, are you ready to change? That's the first question I always ask, because you have to have a change mindset in order to implement what's going to come for your organization. You can't be comfortable with the status quo. You have to you're gonna have to make people uncomfortable. And I think Rob kind of mentioned this earlier about the CEO that he was working with. They don't want to be uncomfortable. And sometimes when you're implementing new processes, the initial is going to feel uncomfortable. It's going to feel foreign. Of course, we totally understand that. However, you're going to have a team of experts that's going to walk with you throughout this entire process. We'll help you brainstorm and identify those overall strategic goals to move your organization up this overall pyramid. So if I find someone in that tier 3, tier 4 area, the first few things we'll start talking through, as you can see on the overall chart that we have here, is what are your current turnover rates? Probably one of those areas that we're looking at. What are your current processes that aren't working? If you don't know these, it's time to have a conversation with your employees, because they will be willing to tell you. I always say your employees are some of your most valuable people, that they're going to tell you what's working right. They're going to tell you the toilet paper is not filled in the bathroom on the 3rd nursing unit floor. They'll tell you that the microwave isn't working. They'll also identify what processes aren't working for your overall organization. You have to have a listening ear in order for your organization to make that change happen. So if we're in these overall tier 3, tier 4, I'm sure there's some listening that's being not done for the organization, and obviously it's shown through your overall leapfrog score and your CMS rating. From there, I would work with them to build out a plan for their strategic team. If your quality leader is not a part of your executive team for conversations around funding and also around strategic planning, you're doing it wrong. We always say your quality leader for your organization needs to be, number one, well-versed, have the information to be able to back up any of their claims, but they need to have a seat at the table. They need to be able to share with you what your current risks are, both now and in the future, be able to identify those. And having a system like a ParitySoft will be able to vet that information for you. I mean, you can see it in real time, whether you are having high turnover or having high issues in the emergency room, or whether you're having or seeing issues throughout your overall organization. They'll be able to identify those hot spots and get the help that's needed for those particular areas. And then from there, we'll just build out a plan in order for you to make the strides to move those leapfrog stores up, to move up your overall CMS, and also able to have a significant impact on everything else that's listed in the pyramid here.
Yeah.
Fairly simple, but it requires change. It requires a listening ear, and it does require an executive team that will include or would be willing to include their quality leader in those important conversations.
It's very well said, by the way, Timothy.
Mm-hmm.
Thank you for that. It reminds me, you guys know I'm an old college football player. I was a quarterback, and I had the good fortune of working for or playing for the famous Tubby Raymond at the University of Delaware. Tubby would always say, yeah, we want touchdowns, but every touchdown begins with a first down.
Yeah.
So you march down the field one first down at a time. And that's sort of what we're saying about the pyramid, right? I mean, HRO is a home run or a touchdown, but you've got to start off with base hits and first downs. That's what you need to do. Start performing. Start doing what you need to do to improve. And having the right system to get you there is critical.
Absolutely.
What would you add to that, Rob?
So honestly, that was extremely well said. I don't know that I have a lot to add other than to reiterate. You have to start somewhere, and you have to be willing to be uncomfortable. There's wanting change without feeling the change. There's wanting to invest in quality without taking the time to understand the spider web of the cost of poor quality. There's how every single action within your organization should be done under best practice, should be done under change control and change management processes as it grows. And all of those things are quality. And your revenue cycle management team should not operate separate from quality. Your contract management should not operate separate from quality. We just talked about the hospital that closed down because of that. So again, to reiterate what Timothy said, they need to have a seat at the table. And the hospitals that I've consulted for over the years that brought me in to meet with leadership, are continuing to grow. The ones that said, here's your desk essentially in a hallway, here are a whole bunch of the patient complaints that we're behind on. Please help us catch up using our process and do not suggest anything different. Those hospitals are not doing well, and I look them up every once in a while, and I see that they are still not doing well on Leapfrog. They're not doing well on CMS. They're in the news for headline incidents. And it's because they wanted me to sit down, shut up, and not participate in operations. You cannot do that with quality. And quality drives. You talked to Gary about your hip. There's the reason that we got better. At patient progression, patient outcomes with hip surgery is because of quality data, right? Yeah. They said, stop letting people rest in bed for 3 days afterward because we thought we were being nice, right? We want them to rest in bed. No, get them up, get them moving. Their outcomes are better. And we got that because we had more incidents of poor patient outcomes. And we collected that quality data. Quality data drives every single thing that we do in healthcare. To not put us in the forefront of your operations, it doesn't make sense. So
Timothy, what's the last word? Give us a last word.
I wanted to go off script and really hit a point that Rob made me think of. We're not asking you to do anything illegal. We're asking you to do essentially your job. We're having patients come to a health
the right thing. Do the right thing.
Do the right thing at the end of the day when it comes down to quality. Have a system in place that allows you to track incidences, that allows you to create action plans around those incidences to prevent reoccurrence of things that should not be happening in the healthcare industry. We're pulling funds from different departments to pay for issues that we should not be pulling money from, and we're not scheduling and being proactive in the nature in the healthcare industry to reduce these issues that are essentially common sense errors at the end of the day.
Yep.
Things that should be taken care of. Broken equipment, small errors that lead to bigger issues, and unfortunately that lead to deaths and unfortunate deaths in the healthcare industry that should not happen. So we're providing an opportunity for healthcare industries to stand up and say, I want to make a change, and I want to go about it the right way, and I want to be able to track these incidences and reduce the overall risk for our patients. It's a no-brainer, but for some reason we can't get through their minds on that in the healthcare industry. So it kind of bothers me a little bit when it comes down to the end of the day. But I think that's one of the issues that we all
my recommendation to leadership is humble yourselves. I know it's hard in the medical world when you're a doctor, where everyone is doing things that the average person doesn't do, and it definitely affects the ego. Get over yourself.
Yep.
And start thinking about the details. The devil is in the details.
Absolutely.
And if you think you're immune, you're arrogant. That's your litmus test. If you think you're immune to any of these problems, then you are completely lying to yourself. You're delusional. Quality needs to lead everything you do. And you need the right systems, you need the right expertise, you need the right technology, and all of it works towards the end of making you the #1 hospital in your area, in the country, maybe in the world. And that's what it's all about. And that's what we're here to do, is to help you no matter where you are. So if you're finding yourself an F leapfrog rating or a DF leapfrog rating, it doesn't matter. We're here to help you with your journey. Give us a call, give Timothy a call, and we'll get you started. And we're excited to maybe be able to do that for you. Thank you for listening in to our after show. I know we were ranting on, but we were holding all this in during our LinkedIn Live broadcast, and we had to have a next month. You still there?
Yep.
My phone rang while this is going on. I apologize.
Your phone's on Friday mode. Totally makes sense.
Yeah, it's fine.
Next month is the strategic planning conversation about having a seat at the table, which is an amazing segue from there's what we talked about today. There's in understanding the impact that we have in quality. There's on the operations of the healthcare facility.
Absolutely. Let us know what you guys think about the after show, and if we should continue. And if you have questions, put them in the chat. We'll definitely take care of those and continue the conversation as we're moving forward.
Awesome.
Thanks for joining us.